As COVID-19 continues to take a toll on Texas and the country, we talk a lot about the bad news. Let's talk about some good news. A drug called Remdesivir is having some positive results, and some of the research is being done right here in Texas. With us this morning is Dr. Robert L. Gottlieb with Baylor Scott White Research Institute. He was the principal investigator for the Remdesivir study released by Gilead. Dr. Gottlieb, thanks so much for joining us here in Austin this morning and talk about this trial.
So my pleasure. Thank you for inviting me. It's wonderful to share some good news in this environment. There's certainly a rise of cases, and we'd like to prevent these cases. But if someone is unlucky enough to get ill from coronavirus, we do have some evidence-based therapies that will help save lives. What we did was we examined patients that were in our trial, comparing 5 days to 10 days, and we found that the patients on Remdesivir had an improved odds of survival by 62% over patients that were hospitalized in hospitals that did not have Remdesivir. Now, that was very early on when the Remdesivir trials were ongoing, so if you weren't participating in the research, there wasn't access. Now there is access to hospitals throughout Texas that's been distributed from the federal government to the state after the donation from Gilead. And so in many hospitals throughout Texas, you can receive Remdesivir under the emergency use authorization. Of course, it's better to not have the virus, and it's kind of like driving down the highway. A airbag will help you survive the accident, but it's better not to be in the accident to begin with. So I would ask that even though we have therapies that will improve the chance of survival, and it's still better to not get infected. So if everyone can wear a mask, and when you're wearing a mask, please make sure the mask covers not just the mouth, but also the nose.
Gotcha. And so just to be clear, this is not a vaccine of any sort. It's a therapy. It helps people survive.
Correct. It is a IV therapy for patients that already have not just the virus, but actually what we call the disease from the virus, COVID-19. And it's only available in the hospitals because it has to be administered IV. There's no pill form of it, so unfortunately we can't deliver it yet outpatient, although we hope to start a trial in late August, early September to examine perhaps if an inhaled version would also be effective.
Gotcha. So this is being administered in hospitals.
Correct. It's we studied a 5-day versus a 10-day course. The first dose is actually 2 vials, and since there is an incrementally increasing supply, but it takes a bit to build that supply, our question was 5 days as good as 10 days for patients that aren't on a ventilator? And what we found is we could actually double the supply, or just about double the supply, by using a 5-day course. And this was done in parallel with the NIH trial that was separate from us that really suggested that there was a survival benefit, but the signal was so strong for their primary endpoint, which was to ask if it could decrease the length of hospitalization, that they let patients cross over from the placebo arm to the active arm. We didn't have a placebo arm. We were just comparing 5 days to 10 days. So we used a different comparator group to show that indeed, now you have 2 pieces of evidence that show that there is a survival benefit. This was the very first agent that was studied at scale. It was a multinational 182 hospital trial. It was a great international partnership, and we were very happy to participate with this at Baylor Scott White in this international timely effort.
Dr. Gottlieb, last question. We've got about 20, 30 seconds just to kind of bring it home for people who are looking for an end to this pandemic or looking for some relief at all. What does this mean in terms of the bigger picture?
It means that I would ask that everyone wear a mask, everyone practice good hygiene practice, and that if you do get sick with mild symptoms that don't require hospitalization, please stay home and self-quarantine. However, if you are sick enough that you need the hospital, please come into the hospital. We do have therapies that will help increase your chance of surviving. Don't think of this as something that we can't be treated. In addition to supportive care, we do have this medicine, and so please come into your healthcare provider. Please come into the hospital. We do have space and beds if, God forbid, that you are sick enough to require hospitalization. If you're not sick enough to require hospitalization, please protect your friends, families, and neighbors, and stay at home and self-quarantine.
Dr. Gottlieb, thank you so much for your work on Remdesivir, and thanks for joining us this morning. I appreciate it.
My pleasure. Thank you.